So first off, thank you for inviting us here to introduce this panel. We at Deloitte are proud of our membership in GBC, both as a board member and in participating in many of the activities. And it's a real honor for me to be here to introduce this panel. I'm extremely excited about this particular panel because I think it sits apart from some of the discussions, but also links into some of the ones you've heard over the last couple of days. And it particularly will focus on, are there market-based solutions that can create social impact while being commercially viable? And can those market-based solutions scale? What kinds of innovations, technology, partnerships, and systems are required to get these market-based solutions to scale? This is a big topic today. The success of microfinance, which now has over $65 billion in assets and reaches 200 million customers, or the success of mobile money, as typified by M-Pesa in Kenya, which now reaches something like 75% of their adult population and contributes 31% of their GDP, have shown that it's possible to have transformative social businesses that create impact, reach new customer segments, and scale in ways that were not thought possible 20 years ago. And so in the context of the variety of speakers on this panel, today you're going to hear about 2 or 3 of these in health, in financial inclusion, models that really do hold promise for doing things very differently and reaching customers very differently. But the task is not easy, and so when we hear these speakers, I'd like you to keep in mind that the complexity of the task and the demands that we make off the private sector and the public sector and partnering with each other and creating things that are new and different have taken a long time to evolve in many cases. Microfinance success today depended on billions of dollars in subsidy over 30 years from development agencies. And M-Pesa in Kenya was started because Safaricom got DFID money to match its initial investment. So there's support required, there's systems required, and there's a lot of partnership and collaboration required to create truly successful business models in this space. And what's also required, and this is probably the final thing I'll say before introducing Albert, is it requires a high level of commitment from somebody within an organization, either an entrepreneur who starts their own organization, or an intrapreneur within a large company who's willing to take risk and champion a different kind of business model to reach new customers and to develop cheaper goods, better quality services that are more affordable, include them in formal market systems, et cetera. At Deloitte and through the recent acquisition of Monitor, we have a strong track record in helping people do this because we feel that where the rubber hits the road, where the implementation is where things get really difficult. And setting up the right systems, the right innovation structures, the right incentive structures, the right capabilities is a crucial part of getting this right, especially if you want to go to scale. So with that, I'll turn this over to Albert. He's currently the health sector lead for Business Call to Action, where he leads business outreach for a number of sectors, but focuses on global health. He has a long and accomplished career thinking about this very topic. He's worked on many sides. He's worked for development agencies. He's worked for major multinational corporations. He's worked as a management consultant for healthcare companies. And he's also previously worked in South Africa for the Clinton Foundation. So with that, Albert, I'll hand it over to you. And thank you for being here for this panel.
Thank you, Anamitra, and thank you to Deloitte for sponsoring this important panel. And also thank to GBCHealth for bringing this topic into the conference this year. I know it's a new topic. And I think throughout the conference we've heard about shared value, about inclusive business, about inclusive growth, and its intersections with global health. And so I think today, this panel will be able to dive a little bit deeper into actual examples of business models that are both profitable and have a great deal of social impact in global health. So I'm with Business Call to Action, which is based out of the UNDP here in New York, and we are a membership of companies that have this objective of having profitable and sustainable business models. So I just want to briefly introduce our panel. We have a very esteemed panel and very experienced in this field. So Anuj Pajrija is the head of social business for Novartis globally. And we'll have to ask you more about that title because it's not a common one that you hear within multinational companies. So we want to hear about your Arogya Parivar initiative in India. We have Michael McBurney, who's the head of scientific affairs for DSM Nutritional Products. And we'd love to hear more about the Cabal initiative, which is working at integrating micronutrients into street food vendors in Indonesia. We have Erica Dadad, who's the managing director at Happy Noi, which works with micro-entrepreneurs. Interesting fact is 30 to 40% of all retail volume in the Philippines goes through local mom and pop shops. And so Happy Noi works with those, that community of micro-entrepreneurs to improve their supply chains, improve their inventory. But now what Erica will be speaking to about today is about how they've worked with generic pharmaceutical firms to actually provide access to care. So within these three examples, we're going to have a great discussion around how do you actually reach the very low-income populations and how do you provide access. And then finally, we have Bill Drayton, who founded Ashoka, I guess, 1981. So over 30 years of experience. He's often called the godfather of social enterprise. So I think within the social enterprise community, he's extremely, he's a hero to many. He works with over 2,000 social entrepreneurs within the Ashoka Fellows Network in over 85 countries, I believe. So we're going to ask Bill to bring in the lens of social enterprise in relationship to a lot of these different initiatives. So with that, I wanted to just turn it over to Anuj so that we can get into, I guess, some of the business models. And maybe you could just start with, I guess, what is the problem that you're addressing? And then what is the business model and how is Novartis approaching it?
Sure. Thanks, Albert. Good morning, everyone. And thanks, GBC, for bringing us this opportunity to present what Novartis is doing. And you're quite right. Initially when I joined Novartis, when I went and told my friends I'm joining there as head of social business, so many of them were actually confused. Either you're social or you're business. What do you mean by social business? And of course, you're not trying to socialize your business, right? So, and to me also, it was relatively a new thing. I come from a corporate background, typical P&L leadership from FMCG, retail, and automotive. And the first time when I heard this was like, I have heard of CSR, I've heard of business P&L leadership. What is this? So what I was briefly told was, it's a for-profit CSR. We're trying to improve the healthcare and medicine access for the poor people across the developing countries' villages. And while we are trying to improve the access, we don't want to be losing money on this. We are willing to live with a smaller profit, but we have to sustainably serve them. So I think it's a very noble vision. Let's look at our world, Out of these 7 billion people, you have about close to 4 billion people who are actually surviving on less than $2 a day. And they're mostly in the far-flung villages of developing countries. So not only that you have challenges of distribution, access, road infrastructure, et cetera, but when you go deep in, you realize there's so much being done by public healthcare sector background, from the NGOs, from the private sector, then why is it the health is still lagging behind? It's quite surprising. You can find a can of Coke there, but you can't find one single paracetamol in villages. So is it a marketing failure? Is it like a consumer failure? Or is it about the health sector or government failure? So what we did, we started with India. We explored as to what are the other models, what are the public sectors, stroke NGOs and private sectors were doing, what are the fine examples of successful models which exist in the bottom of pyramid. And we started combining the learnings of all these sectors and created a model which, the good news is, by 34th month, actually reached a break-even. And today this model, which is called Arogya Parivar, for the benefit of those who probably wouldn't understand, it translates into healthier families, has actually improved the medicine access for 42 million people across 33,000 villages. Now, it looks quite a sizable number, but if you look at the magnitude of requirement, there are about 800 million people there across 600,000 villages. Way long to go in terms of future expansion. And today, by far, I think it has led to improved healthcare access, not just medicine access, healthcare access across these villages where we have women health educators who go and raise awareness about basic health, link to the doctors, build the capacities, capabilities of the local health providers. And with that success, of course, we are moving to our wave 2 of scaling up and rolling this business model out to other parts of Asia and Africa. I would, during the discussion, of course, mention a little about what are the challenges and lessons that we learned there. But largely, this is something that we learned in the last 5 years. It does pay to serve the poor. Thanks.
Great, thanks, Anuj. And I wanted to turn it over to Michael. So Michael, DSM is a Dutch-based nutrition and micronutrients company. And I think Anuj's example is an example of sort of delivery of access and drugs and over-the-counter medicines, those sorts of things. Michael, maybe you could tell us a little bit about the initiative in Indonesia where you're actually integrating healthy food into the supply chain.
Thank you very much. Good morning. When it comes to health, nutrition matters. And we know that malnutrition and undernutrition are solvable problems. When you don't have essential nutrients, vitamins, minerals, omega-3 fatty acids, amino acids, your health is compromised. For children, it is immense. It means they can't develop, they can't learn, they won't reach their full productivity. We're a B2B company that manufactures micronutrients that we sell to other food supplement companies, infant formula, to put into products to fortify them or enrich them. We're proud of our activities with our humanitarian Sight and Life think tank, and we work with NGOs, that World Food Program, Vitamin Angels, Future Fortified, many others. But the story that I want to share with you today is a specific initiative that is built on a social business model that addresses childhood malnutrition, and it gives entrepreneurs added income to be successful themselves and so they can support their family. The story is named Kebal. It starts and is situated in Jakarta, Indonesia, a capital city with 28 million people, 5 million that are living in slums. Many of those people are living off street food. They're buying deep-fried, less nourished or nutrition-rich foods. They don't have kitchens, they don't have access to food, they don't have the cooking utensils or the supplies that they need to prepare food. Think about it. That is a totally different world than what we live in. So the story actually starts in 2009 with Mercy Corps. And Mercy Corps wanted to make the most nutritious street food available in Jakarta. And they put in place in Jakarta 4 carts that were color-branded, had music, were attractive to mums and children. And these vendors would get up at midnight and start making porridges, start making fruit gels, and then they would go out with the cart and they would sell them in the street. That started in 2009. In January 2010, the MIT Global Entrepreneurship Lab visited the site, 3 students as part of an MBA. They evaluated what was the opportunity and came back with recommendations. Those recommendations were, they had already 12 menu carts, or menus that they could have, foods that they could produce, but most of the vendors could only produce 2. They were limited in their capability to generate food to take out. So the story moved that they said you need to have a double franchise model. They recommended having cooking centers and having vendors that were separate. That model was put in place, and in November 2012, DSM became part of this model. What it has done is it has allowed us as a company to sort of reach out and work with these cooking centers. They can produce more volume. They can do more of those 12 menus. They can become profitable. And they need different resources to have a cooking center than a vendor. It has also opened the door to new vendors, because before you had to be able to produce the food that then you sold. But now you can be a vendor that can come to a cooking center, get food, take it out, and sell it on the street. So it's opened the market for us as a company in selling Fortify, our micronutrients, to a new customer. And it's opened up the world of entrepreneurs that can manage cooking centers and the world of vendors that can actually be on the street. Starting from 4 carts just a few years ago, almost 500,000 food meals have been served. There's a whole world of loyal customers. It's a viable business model. Thank you.
Great, thanks, Michael. And one thing that I would love to sort of dive deeper into in our discussion is sort of the nature of the partnership that you had with Mercy Corps and how you developed that. And moving on to Erica, you know, I think there's probably elements of partnership across all 3 examples, but I wanted to learn a little bit more about how you partner with micro-entrepreneurs and how it came to be and sort of the Happy Noise story of and how you're moving it towards global health.
Sure. It's such a pleasure to talk about our work in the Philippines. I think for those who have heard about our country, we're known for a couple of things. We're home to 7,107 beautiful islands. We're growing fast in terms of the economy. But the last mile is a very real aspect in terms of the Philippine context. The minute you go farther north or farther south, you'll see all these shanties. You'll see places with not a lot of access to infrastructure, to clean water, in certain cases, no electricity, and yet you'll find a bottle of Coca-Cola. Why is that so? More than reflecting on the great distribution system of Coca-Cola, there are these small village shops in every community. If you take a look at the brochures that we've left on the table, there are pictures of our mom and pop stores, or what we call sari-sari stores in the Philippine context. Here, the community buys basically the goods they need for the next day or two for themselves and their family. This is also the distribution drop-off point for a lot of the manufacturers and producers in the area. What's very interesting though, like Albert mentioned earlier, it's 30 to 40% of the retail channel. The challenge though is it's highly fragmented, it's very, very fractured, but there's a lot of opportunity there. Looking at the store, it's also important to look at the person behind the store. Most of these stores, if not all, are run by female women micro-entrepreneurs. These are women who are setting up a business to support the family income, to support the primary breadwinners, and who would like a business that's really near and close to the children in the home. In total, as of today, they say there are about 800 to 1 million stores, these kinds of stores in the Philippines. But I think every year we grow by a lot more. Now, in terms of our mission, our goal is really to partner with these micro-entrepreneurs and provide them 3 valuable inputs. The first is education, the second is capital, and the third is new business. When we talk about education, this actually is more of a 10-month program wherein we teach our mothers tools and systems that will allow her certain efficiencies to really understand how to generate profit in the store and how to maximize that profit. As of last year, we've graduated 1,300 mothers. This year, we're hoping to graduate 1,500, and next year, 3,000. In terms of capital, by the 6th month of the program, we usually refer them to microfinance institutions, to rural and similar lending facilities in the area so they can really actually grow their store. By the 7th month, we introduce them to what we call new businesses. And since, as a company, we have a preference for high-impact social goods, that's usually solar solutions, mobile-related device platform services, marketing research partnerships, and what's important today is healthcare and nutrition. When we look at the program as a whole, I think what's important to see is that these women really become a community and also provide a network, a platform. When we talk about the healthcare hub, this actually started with a partnership in 2009 with Unilab, one of the biggest pharmaceutical companies in the Philippines. And what we wanted to see if there's a market for over-the-counter medicines in these stores. They've never been there before, and we thought that with a little training, that could be possible. And we started a pilot with 40 stores, went really well. We found that the committee appreciated the easy access to medicines. They were able to get it to 15 to 20% lower than the usual cost, without transportation as well. And really there was a growing awareness about how valuable nutrition was and is today, and how that has to be at the center of any home. And all of this was done through our store network. So it's really exciting for us.
Great. Great, great. And I think in all three examples, it's sort of going to the customer or the client or the populations that you wish to serve at where they are. And so I think all three examples are fantastic examples of market reach and serving low-income communities. So one of the things that, as panelists, we talked about before was we wanted to make sure that we were on point in terms of addressing what kind of issues that you wanted to hear about today. So I'm just going to I wanted to do a quick show of hands just to get a sense before Bill jumps in on your, so first I'd like to ask, how many of you are involved in, I guess, your company's CSR efforts okay? And then how many of you are involved in social businesses like the ones that we've heard about today? Okay, great. And then just in terms of what we want to spend the next, I guess, half an hour on, I'm going to ask three questions, or three areas that we could focus on. One is sort of more on the business model, learning a little bit more about the profitability and how you actually make this work from a business model perspective. The second is sort of if you want to learn more about sort of the partnerships aspect and how you work between sort of large multinational companies and social enterprises. And then finally, the last topic that we could focus on would be what are the tools that you as social entrepreneurs need to sort of go on the path that these panelists have gone on. So those are the three things that I'm just going to say, raise your hand if you're interested. So more on the business model side, how many people are interested in that side of things? Okay. More on the partnership side, okay, this is going to be pretty evenly spread, I think. And then finally, social entrepreneur sort of toolkits and, okay, all right. Okay, good. So, Bill, I don't know if that sets you up in terms of understanding kind of more what the audience is interested in. It seems pretty balanced, so maybe we'll try to address all of them. But maybe, Bill, given that you work with so many social entrepreneurs around the world, some of them commercial, probably some of them sort of more nonprofit, maybe you can just talk about, reflect a little bit on the three examples that you've heard today in context of what you're seeing globally, specifically related to global health.
Well, I think if you think of these three stories and you think about the number of hands, first thing is these are not small stories. And they're not small stories in part because they're about changing the pattern. And we know you can't ignore things when the pattern changes. So there's a frequent misperception that when you talk about social, it means small. No. So there's a very profound change happening now that's affecting everything, health included. And Ashoka's in a really good position to see it. We actually have 3,000 Ashoka Fellows, leading social entrepreneurs. They're very powerful. Over half of them have changed national policy within the first 5 years, and 3/4 the pattern in their field. So what is a social entrepreneur? Well, it's an entrepreneur, which means pattern change. But social means from deep within, they're committed to the good of all, and therefore their work is. And that gives them a great competitive advantage because they're listening to everyone. When you look at these 3,000, it's like a giant mosaic. And it really gives you a very clear sense of where the world is going. So there is this very deep, profound change, and it's critical to understand that, and then we'll come back to what it means company by company. For most of humans' existence on the planet, there's always been some change, evolutionary change at least, but it's been so slow and episodic that it was invisible in the course of a normal life or organization. And the game was about efficiency and repetition. We got better and better at that at bigger and bigger scale, so think assembly line, law firms. Education was about mastering a body of knowledge and repeating it over your life. You are now a baker or a banker or whatever. And we all know those systems are failing really badly. The half-life of the Fortune 500 US companies has been getting shorter and shorter for the last 40 years, i.e. the death rate is accelerating. And why is that? Because since 1700, when business did something really radical. They said, anybody who's got a better idea, you implement it, we're going to make you rich, and we're going to copy you. And that set in motion the multiplication of change. So from that point on, the rate of change has gone up exponentially. This is a mathematically true number, or curve. And that means this world is failing, and in its place, we're getting a very different world where the key factors for success organizationally are you've got to be a fluid, which means no walls, no business, social, or other walls, open, team of teams, which means everyone is an initiatory player. This is really different from over here. That's what Bangalore, Silicon Valley, you know the success stories, that's where they are. This also means that people, all of us, everybody, has to have a different set of skills, a very high level of cognitive empathy, teamwork, a very different type of leadership. When everyone's initiatory, it's not like the old assembly line and change making. So let me ask, where is your organization in making those transitions? And where are all of us in terms of learning those skills? So I'll come back to that in a minute, but I want to come back to the theme that this is big, this is not small. We're now at a tipping point. It's going fast. It's going to go really fast in the next 5, 6, 7 years. And of course it affects health. It affects every sector. And it is not just marketing to the base of the pyramid. It's every part of the value creation process. I want to just take a couple of examples that are consciously chosen not from the base of the pyramid part. We have some really good examples here. So a couple of years ago, Procter & Gamble came to us, Ashoka, because they'd heard of work we were doing that combined safe drinking water, distance diagnosis, and local pharmacy at the village level. And they thought, oh, this might be part of their future in terms of a new service. 5 years before, they had made a corporate decision. We can't compete if we don't have a completely open system for new products and services. That was a really smart move. Another example, this is an American fellow. He looked at cataract operations. So in Egypt, for example, very, very few, small percentage of the people who needed it were getting them. The average cost was about $230, $240. The average monthly salary then was $60 to $70. People are basically willing to put a month's salary into this operation. So to clear the markets, you have to drive the costs down. That required changing every step in the value-added chain. So doctors now do hundreds, not 20 or 30 surgeries a year. Thousands, actually. And the cost of intraocular lenses, this group now manufactures and sells at $2.50. At that point, they were selling for 50 to 100 times that. They've done the same thing parenthetically with hearing aids and whatnot. So here you have a social entrepreneur who's changing the whole value-added chain. In India, the numbers as a result have gone in 8 years from 800,000 operations to over 5 million last year. You probably read in the paper, the lead article in the New York Times business section, April 24th, was about the freelancers union. Well, they have an insurance system that works for the 40% of the US labor force that are freelancers. And they've now set up a different way of delivering health care. There are 550 of these stories just in Ashoka, and they're all about pattern change. This is big, it's important, and there's an opportunity for everyone here to play. But you've got to recognize that this is a moment of very, very profound change. And ask yourself again, how are we doing in becoming a fluid, open team of teams? Not just open to the citizen sector, but to all sorts of crosscuts that you haven't thought about before. So I'm just going to give you one example, not from health, just to drive home that this is a universal pattern, and you can look for openings elsewhere. So in India, 24.8 million housing units are missing for informal sector workers in the cities. You buy vegetables in the morning, you sell them, you make a profit, you can support your family, and you can afford a 200 to 280 square foot house. But no one builds it for you. Why? Because you don't have any paperwork. And this is sort of small, and who are you? And so business doesn't do it. Citizen sector now big, low cost, lots of will, but no skill at real estate development and no access to marketing. You put those two together, the citizen sector does all the dealing, marketing through collection, the builders build, the financiers finance, and as of January in Ahmedabad, 12,000 units done, $75 million of totally private financing, 10 other cities it started. This is a $340 billion new market. Before one more of the 700 million people in the Indian villages move into the cities, or you think about 340 square foot houses or other countries. Now, this is a time of very profound change. All the rules are going to go. And it's a huge opportunity. This group of people decided to be here because you're in this game. And I just ask, don't think small, don't think only base of the pyramid, think we all together have an opportunity to change the whole system. Thank you.
Great, thanks, Bill. And I want to pick up on sort of this team of team concepts, which you mentioned a couple of times, and this sort of relates to partnerships. And maybe, Michael, I wanted to turn it over to you and see whether you could describe a little bit about your partnership with Mercy Corps and sort of what are the values that each of the different partners bring into the picture.
We have two business entities, or two entities within it. One is new business development that every company that's of any size will have. The other within our nutritional products division is the nutrition improvement program. And they're both tasked with finding new business opportunities, growing our business. It's not corporate social responsibility. It's increasing shareholder value and expanding our reach. And so just like, you can look for new widgets to put into your products to improve their function, or new processes to improve efficiency in manufacturing. We also look for new customer opportunities. And that's how this came about with Mercy Corps. Because in our discussions and dialogue, we met them. They were looking at this business model. It was intriguing to us, but what really moved it forward was when it grew beyond 4 carts, because we're not really a company that can deliver micronutrients to 4 street vendors to do on stoves in pots. I mean, one, that's not the way we operate, but 2, it's not the way you make quality food products. There is a food industry out there because as consumers, we expect to have certain standards. These things need to be added at levels that are appropriate and that there's quality done. With the introduction of cooking centers, that became possible for us because now our sales and marketing force had a target population that we could do, and we can see it's small, it's at the beginning at this point, but we believe in this model. We can see the opportunity in this model, and we think it has a future, and it's our path to help improve childhood nutrition, to help improve the quality of living with those entrepreneurs, and to create a sustainable, economically viable business model.
Great. Thanks, Michael. And yeah, I mean, you're touching on sort of utilization of your own core competencies and finding out other partners that have the best core competencies to hit on the value chain that Bill has set out. Erica, I wonder if you could talk a little bit about sort of the partnership in terms of the Health Hub initiative and the Pharmacy Association and
Sure.
The various people that were involved in the scale-up of that.
Yeah. Well, when we started the Health Hub, it was a very great time because the law had just changed. So with the changing of the law in 2009, it allowed us to bring medicines all the way to the sari-sari store. Before that, like in so many other countries, they were only available in pharmacies and drugstores. So the biggest challenge for us was, even if they were just over-the-counter medicines, did our mothers, our nanais, what we call them in Filipino, did they have the skills required to be able to store these medicines, to do the proper due diligence when talking to customers? Because obviously they just can't hand out medicines to just anyone, even if they're just over the counter. So when we partnered with Unilab, they understood this. They totally were on board with our developmental approach, and they said, why don't we train these mothers? It's just a quick session, maybe a day or half a day, and let's work with the National Pharmacists Association of the Philippines. And basically, they certified all our mothers who were interested in the program, taught them how to handle these medicines, talked to them about the different kinds of things that they could keep in the store, with the questions they needed to ask, and even if they were difficult, especially because the people who would usually buy from the stores are people they know. They have relationships with and have lived, or have been their neighbors forever. So you can't just dispense medicine and say, sorry, you have to go. And at the same time, we appreciate how they also taught them to escalate it and say, I think it's time to see a doctor, which is very, very important in understanding their role, like where it begins and where it ends. What's also very exciting is that when we started to bring in medicines, we brought in just a couple of SKUs. And then as the months went by, we just started to add more depending on the demand of the market and what they were looking for. So when we started with generic and branded vitamins, we later on added diarrhea medication, cold and cough. And we also started to understand the profiles of our communities better. So that, I think, was the kind of information that our partners really liked and added value. So there's a lot of shared value between the community and our partners.
Right. Great. Thanks, Erica. And Anuj, I know that with Rogia Paravar, a lot of it, because you were started, I think, 2009 or 2007, so quite a while ago, you built a lot of the infrastructure in terms of the reach, through Novartis's systems. But could you talk a little bit about sort of what you look for in partners, whether they're sort of large multinationals such as yourself or smaller social enterprises or nonprofits? What do you look for in terms of the partnerships that you develop?
So I think, of course, we are a multinational. Doesn't mean we'll go only with the multinational or large-sized players. There is an advantage of course, dealing with large-sized sector organizations. But there are many, I think, areas where probably these smaller organizations and NGOs make more sense. When it comes to having the relationship with the community, being more grassrooted to understand what are the local cultural context, and how to execute it more in a local area is somewhere I think NGOs can do a far better job. What we bring on top is an organized way of doing these outreach programs. Of course, resource management, definitely the medicines, which is our core competency. But I think one has to look across sectors to even find, for example, we worked on facilitating capacity building for doctors. You go to these villages, the doctors do not have in-clinic diagnostic facilities or enough things to treat these people. So you work with the microfinance institutions who are usually more localized, who then provide these small working capital loans for the doctors. Now they can more efficiently manage the local lending, the monthly repayments, impact on business rather than Novartis. We cannot reach out there. So I think it's a blend of both. The mega size brings in an organized efficiency way of doing things more efficiently. But I think the local, smaller organizations bring their more local partnership, understanding of the local context. So I think this is how we learned across.
Right, great. So, we've talked a little bit about sort of partnerships, and I'll open up for questions if people want to delve more into that topic. But I wanted to turn over to Bill, and maybe you can talk a little bit sort of about, you deal with social entrepreneurs that are in large and small organizations, et cetera, et cetera. How do you, what kind of advice, I suppose, would you give to people within, I think this audience is a combination, but a lot of large multinational companies. What are the skill sets to develop in terms of being able to push through social entrepreneurship within a large company?
Okay, first of all, it's really important to choose your partners. There are lots of social workers who do great social work. There are lots of people who run tobacco stores. You don't want to deal with them. You want to find the entrepreneurs. Entrepreneurs work really well together, regardless of sector. Then you've got to actually figure out how to make the new system work. And it's not going to be taking two old systems and just introducing them to one another. You really have to design something very different. Just to use the housing example, so we did the work of introducing these people, business, society, finance, to begin with. And that required changing the whole financial structure, as you could imagine. It required a lot of redesign. Well, we don't want to be doing that beyond the first couple of cases. So then it becomes necessary to create the equivalent of the real estate agent who's going to constantly be putting these deals together. So housing for all entrepreneurs. And okay, how do we do that? Well, 1% of the deal goes to them now. If they put together 500 of these 280 square foot houses, that's not bad. It's $100,000, which in India, that's sort of good. But the core skill ultimately is how do you find the right partners? How do you together design the new system? So in many ways, the core skill is, and this is probably the core skill going forward in general, how do you design hybrid value systems? Once you tear down a wall, that doesn't give you the value. You've got to then also be able to add, how do we get these groups of people who were not working together before, who maybe don't even like one another a whole lot because they weren't working together before. Now, how do you weave them together into a new hybrid value system? And then I would add, because we're now in a world where everything is changing, and the game is not A fits B because you keep doing the same thing, but A changes, and A bumps B through Z, and they bump everyone else, so that change is begetting and accelerating change. So when you design a new hybrid value system, you're going to have to constantly redesign it.
Great. And I wanted to shift the topic to, I guess, business models. And I guess, as in large companies or small companies, everybody has to be sustainable, right? And so I wanted to get your sense for, is that a long-term investment? How long did these different initiatives take in terms of the payback period, and how do you manage that length of time within a company? So I don't know, maybe Anush, you can start.
So I think when we started this in 2007, of course we didn't have a history. We could only forecast from our little experience as to this could be reaching a break-even point between, say, 6 to 7 years. So that's the kind of mandate that we had from our global leaders. It's rather good that it took us less than 4 years to reach the break-even, but doesn't mean that it works the same way across all other countries. We're facing different kind of challenges in Africa and different ones in Southeast Asia. But I would say anything between 3 to 5 years is a reasonable amount of time that organizations can look into before they reach the break-even. But usually that takes a leading organization or one with the deeper resources to stick around their neck for that long. Usually with the smaller firms, that's where the challenge lies. You may have the intent, you may have the purpose, but then your abilities to sustain that long before you reach the break-even might be even lower. So at Novartis, I think we look at generally between 3 to 5 years.
Okay.
Yeah, but it's important for us to have the break even because after all, it's a business initiative which is trying to lend a lot of social benefit. So it could be eroding your shareholders' value for long.
Right. And could you comment on sort of the process of managing that? Because I imagine that, you know, if you're compared with other business units, then, you know, you're sort of, it's maybe you can talk about what does that process look like?
So I can talk more specific in Novartis. I don't know whether I cannot say this is the right way to do across sectors. But within Novartis, what we did, we carved out an organization which is managed more like a virtual P&L. So we're not a legal entity as a social business, but what we do is map our resources, our results, and our investments separately. At the end of the year, of course, everything sits back with the divisions because they're the legal entities there. And by doing this, then you provide different incentive and resource structures for social business group. So we have definitely separate KPIs. I mean, use this word, assuming a lot of people from the corporate world here. But we have separate goal sheets, if I might use a simpler term, both for social goals and for commercial goals, which are extremely different than what the mainline or the flagship businesses in the cities might be. For example, we would be more measured by number of people that we've been able to lead better healthcare for, how many, let's say, doctors could be trained this year, how many infrastructure development activities that we could develop. And all of this also alongside supply chain and the medicines, range of essential medicines that you could supply into a number of villages. So that could be more from the social KPIs. And like any other business, of course, then you're measured for your top line, your expenses. But our bottom line, of course, relatively is far lesser than what you would have in the mainline business. So you need to keep these KPIs, goals, measurements, incentives separately with a time frame of certain agreed sustainability points.
Right. And Michael, how about, is that pretty similar process within DSM in terms of the Cabal Initiative or other similar social business initiatives?
Well, I think I'd build on Bill's comments in that there's no single model that's right, okay? So it's going to be situational dependent, and you have to think about it from that. So you can be in a business unit that can have goals and social responsibility corporately. They can have them regionally. They can have them by business unit. And so all of those will be different opportunities. In our case, the Nutrition Improvement Program is a business-specific and managed activity that has a portfolio of projects. And so each year those are reviewed, and some of those will be longer term and others will be shorter term in terms of the return on investment or expectation. But I think my advice to you is you have to pursue what's the opportunity, the low-hanging fruit within your organization to set it up.
Right.
Find the champions.
Right. And Erica?
Be a champion.
Sure.
I like that.
Erica, how does Happy Noise sort of manage, you know, I don't know, do you still have a lot of grants coming in terms of setting up the organization? Are you completely on earned income? How does it work? And specifically when you roll out new programs like the health initiative, how do you roll that into your overall business?
So first, to start with, when we look at sustainability, we first look at the model of the mother. Because even before we bring in any new business, we have to make sure that the store itself is sustainable. Otherwise, it's not only the cash, it's the compliance and all the other legal requirements that have to follow. We're not sure if she can meet it. So at the very base, we have to make sure her business is okay. And then once we bring in new businesses, each business line has to be sustainable within the first few months, if not immediately. The upside there is because she's already base operations, she gets enough from the store. Everything else is incremental until it's more than incremental. For us, it's a little more challenging because the way we're designed, and legally there's no legal entity in the Philippines known as a social enterprise. We have both a foundation and a corporation. The foundation has been fortunate enough to receive a lot of grants for all these scholarships, whereas the corporate side generates revenue from marketing, research projects, similar things, and commissions from distribution and margins. But all our profits are targeted towards more and more scholarships. So the synergy is really aligned with the mission of the company. It's really a challenge to manage it on a day-to-day basis. It's taken us 4.5 years. We're 5 years old. It's taken us 4.5 years to break even. And it's going to be more and more challenging as we expand, but we're confident about our path to growth.
Great, thanks. I wanted to open it up. I feel selfish to be asking all the questions. So I wonder if there's any, do we have a mic? Is there anyone that has a question? Sure, this right here. There's a mic coming to you.
Hi, Ilza Melgailis with the UN Foundation. Great panel, thank you. I have a very specific question for Mr. Drayton. You mentioned it at the start that half of the work of your Ashoka Fellows has resulted in policy change. Can you just share a little bit about the process of how that happens and how much of it is done actively versus how much happens through other factors or processes?
Sorry, what was the first, how much of it is done blank? I didn't get that word, the first part.
Oh, how much of it is, do your fellows or do you as an institution say, we want to affect this change, and so you do so purposefully, or how much of it happens just organically or through other processes, passively, as a result of the activity of the fellows?
I would guess it's about 98% purposive. The nature of the entrepreneurial process is you know where you're trying to go. You can't possibly have a business plan if it's a big change because the world keeps changing, but you know it's a big win for all the key actors. And for years, you're iteratively listening, experimenting, changing, moving it along. And 3/4 change the pattern in the field. So that means about 2/3 of the fellows have to change policy to get where they want to go. And so if that's what you have to do, you have to do it. And then there are many, many ways of doing it. Is that responsive?
And I wonder if I could ask sort of the three company representatives as well, is how much does policy impact, I guess, the work that you do? I don't know if there's any one of you that wants to take that. Anush?
I think here, when you look at the public policy versus what a private sector mandates are, there is a lot of difference, right? So there are not hard and fast boundaries. So as you see evidence or as you see results, you get more buy-in, and as you get more buy-in, of course, you get additional investments. So I think it's like a step-on approach, which happens with your performance and delivery.
Right.
There are areas where I think we are highly governed by our, let's say, code of ethics, compliance, et cetera, which is good, irrespective whether you work in the cities or you work in social business or in the corporate. But there are areas where we do make a little bit of exception because you're going in for something which is like blue oceans. Nobody has ever been. So it's a give and take.
Right, right. And Erica, you mentioned earlier that there was a policy change for the distribution of medicines in the Philippines. And so that allowed you to do that. Do you see a lot of those kind of openings, or do you have to be more prescriptive, as the question says, to try to actually drive the policy change?
So we have the good fortune of being one of the bigger social enterprises in the Philippines. And in the last maybe 2 years, we've gotten a lot of coverage. So the more people learn about our model, the more opportunities have come our way. But there's still a need to really push policy. There are a lot of opportunities for our communities, but we're not in the best position to be able to do that because of a lot of the policies now. What's very interesting, though, is one of our co-founders recently ran for the Senate and just won. So that's part of his agenda. It's pushing a lot of these social enterprise policies and seeing all the other opportunities that we can maximize so that our communities can get the most benefit.
It's a good way to do policy change.
Yeah, exactly.
Run for office. Any other questions from that? Yes. He's almost there, yeah. Great.
Hi, my name is Rebecca Kohler from IntraHealth, and it's a great panel. And one of the things that we've been interested in is the education and training sector. We're an organization that's driven to try to expand access to training for health workers to address health worker crisis issues and other issues with the health workforce, and have been wondering if there has been examples, maybe it's for you, Bill, around capacity building or training social businesses, in the U.S. with companies that have access to training, like the Phoenix model, for example, where there is a business to be had by doing training. And I'm wondering if there's been any social entrepreneurs that have been successfully introducing new models of training where they've actually been able to, not a lot of profit, been able to make it sustainable.
Oh yeah, it's absolutely fundamental. First of all, there's, as I think I mentioned, a really big difference between a social entrepreneur and a business in a few areas, and one of them is maybe the organization looks small, but almost every social entrepreneur has a movement. They make their ideas as simple and understandable and safe as possible, precisely so that thousands of people and thousands of communities say, oh, Rebecca's idea, that's pretty good. We want that in Phoenix or wherever, and we're going to make that happen. And so that's a very huge lever. And then each of those people recruits and role models for others. And so if you look at the expansion of the leadership in any field, that building of a movement is a really major part. Then, of course, you have to look at the other ways of getting people up learning curves, especially when you change the game. You have to help people learn how to play a different sort of game. And how do you deal with the fact that we will never have enough doctors and highly trained people for the population in the world? So overwhelmingly, when you look across the social entrepreneurs, they are finding models like the models here, where people who are not those highly trained people are providing the services, families, whatever. So here's an example. We have 3 fellows, one in India, Brazil, and Mexico. Each independently came up with ways of having families, neighbors, peers deal with acute mental illness. They were able to deal with about 70% of it. They've since been picked up by the World Bank and others. Well, once you start recognizing that you have to engage very large numbers of people, then you have to figure out how you get them the tools. And as you know now, there's a very strong belief that we have to go beyond even that and suddenly pull together all the data from all the patients and all the stovepipes of individual companies and individual academic researchers, because we've reached a point in the health sciences where you simply need all the data. And that again changes the picture very, very dramatically and gives power and gives access to information.
And Michael, look, you wanted to...
That's a really important question, and it's part of what has made us successful with Mercy Corps, is because we have been able to be involved to help them at the cooking center level to understand how to add these nutrients, when to add them, how to do it properly. Okay, so that's a really training and education. What is proper sanitation? We're also part of Partners for Food Solutions with General Mills and with Cargill. And that is a technology transfer, because a huge barrier to these small and medium-sized enterprises, these entrepreneurs, is just getting started, okay? They want to put in a mill to do some process, or they want to be able to fortify something, and having somebody that can just tell them as from an engineering perspective, this is how you should, that can look at plans and just say, set it up this way. It doesn't mean that you're making the level investment higher, you're just giving your experience, your practice, your knowledge, and sharing that with them. And so our people do that remotely. They don't travel to these areas, but we put together connections so that there is guidance and information. So we have volunteers that then feel excited because they're helping to make a difference in Africa. And we also know we are making a difference in Africa because we are starting to enable these entrepreneurs to be successful, giving them the tools, the education that they need.
Great. I think we have time for one more question. This gentleman here.
Thank you very much. My name is Stephen Ram with Apt Associates. I have a question that is perhaps related as a good segue there. but more about financing and scaling. We haven't quite gotten to that yet in the discussion today. A lot of people out there talking about impact investing, both private, a lot of bilateral, multilateral donors creating different types of funds. Obviously, Bill's organization is really based on helping these entrepreneurs finance their activities, but perhaps from some of the folks in the social business side, hearing what are some of the pitfalls. The advantages are potentially obvious for us, but what are some of the pitfalls of different of social businesses or entrepreneurs taking on investment of different types, whether that be bilateral donors, multilateral donors, private financing, that you might have experienced or seen?
So maybe Erica, I don't know if that's, I'm not sure if all of these are sort of internally funded within your corporations, but maybe Erica, you can talk a little bit about sort of your interaction with development agencies.
In our experience, I think the most, regardless of what kind of funding it is, like Bill said, the most crucial part is finding the right kind of partner. So in the end, if the one funding doesn't understand really your mission and the kind of work that you're doing, whether it's the goals and the financial indicators, then that for us is always the biggest challenge. So even if it's a great deal, if they don't understand our work, we're not likely to take it. Not because we don't need it, but because in the end, it's going to be a real challenge to manage that kind of relationship. So for me, it's always the kind of partner. We need someone who's very like-minded, who understands what we want to do, what we're doing, and where we want to go, basically. I hope that helps.
Bill, I don't know if there's an experiences from from all your Ashoka fellows in terms of how they manage financing and.
Oh, I think this is really important, and APT has been working on this for a long time. We're in the middle of the takeoff of an entrepreneurial wave in social finance. This is very normal. We've had a dramatic change over 20, 30 years in the operating side, and now the finance and legal sides have to catch up. And it's a mess. I mean, we know it's a mess. Foundations do not have to listen to the clients. It's a fundamental structural problem. And in especially a time of accelerating change and you're not having to listen to your clients, it doesn't work very well. If you're an entrepreneur, regardless of background, and you don't have funders who really respect you as someone who's an entrepreneur who's seeing something new, and if instead you're being told, oh, well, we have this strategy, that's a good word apparently, and we're being transparent because we're telling we have this strategy and therefore we can't listen to you because you're doing something that cuts across our organizational, I mean, it's just awful. And, you know, the entrepreneur, especially if you're having to deal with social as well as business, well, democratic societies are designed to move slowly. And that doesn't work when you've got a 1-year time horizon or maybe 2 years if you're lucky. And this is the entrepreneur's life. It's not a project, it's not a job. And well, they can't do loyalty to that because that requires judgment. And you need to build an institution. Well, that's overhead. Oh, we don't do that. I mean, like, this is just a mess. And governments are better because they have a nervous system, but it's frequently connected to the wrong thing. So, especially in the development field, I mean, how many voters vote in the US who live in Mali? So I mean, we just know this is a mess, but we also can see there's this tremendous wave of innovation coming. And that's another great opportunity. And we've got business moving into this area where I hope we're going to see government finally be rescued from being the last pre-modern sector in society. We really, really need that. And there's all sorts of very innovative things. So we talked about the eye care thing. So Deutsche Bank and we work together, and there's a small eye care fund. Well, you know, if the folks who are doing those cataract operations, you know, they're good organizations. Now they can expand. Well, okay, where are they going to get the money for that? Well, if you can get the debt money and then there's some private charitable money that helps them with operations, well, that's a very viable model. So there's so many opportunities for new ways of financing at the moment, and it is so needed. It is one of the cabooses in this change process.
Great. Well, I'd love to continue going, but I think we've run out of time. But it has been fascinating to hear about 3 really great examples and leveraging Ashoka and Bill's experience in the social enterprise space. And I think there's a lot of momentum, I think, moving in this, and people know what social business and social entrepreneurship is now. So hopefully we'll hear many more stories from all of you about your examples in the coming years. Thanks so much. Can you please help me and give these guys a clap?